Hi, I'm Dr. Greg Costello, board certified family practice with CostelloWellness.com, with a quick video to warn you to avoid stem cell therapy and all the hype and promises that go along with it. I'm getting a lot of questions lately, especially from my older knee patients who I treat with the gel therapy, about if they would be appropriate for stem cell therapy. There's all kinds of radio ads in particular, but also newspaper ads and some TV ads touting stem cell therapy as the treatment for basically everything from knee pain to rheumatoid to shoulder pain and back pain and sciatica and everything. So first off, most of the stem cell therapies that are being advertised are actually advertised by chiropractors who are not medical doctors and not allowed to do injections. They do the advertising and pay a physician in the office to do the actual procedures. Second, the majority are not actually giving you stem cells. They're giving you dried, frozen, either placenta tissue or amniotic sac, which is true that they do have stem cells naturally, but the processed product that you're getting for injection does not contain stem cells. It does contain growth factor, which is healthy for you, but it is not stem cell and it is not interchangeable. So if you go somewhere and they're not poking you with a needle to get your stem cells, I would challenge them to tell you where they're getting the stem cells and to show you proof or anything in writing that the manufacturer is actually claiming that they are providing you with stem cells. They're not. If you do get stem cell therapy, you should take it either from your hip, which is your bone marrow, which is a multipotent stem cell, which means that it is a stem cell that can be turned into many things, including cartilage and muscle tissue. You can get fat-derived stem cell, which is taking it from your belly usually, like liposuction, but there's stem cells in fat tissues. It is not quite as good as the bone marrow, but it is definitely easier to procure. Should be cheaper because there's no hospital charges and no anesthesia to do the procedure from your hip. The other issue is that most people, especially elders, are so far advanced in their arthritis or their disease that stem cell therapy should have been offered 10 or 15 years ago, not today. The analogy I like to use is if you're trying to grow sod, grass, if you put that sod on top of a gravel driveway, it's not going to grow because there's no healthy base for it to establish. So the severe arthritis that most people are grasping at straws for to have therapy is not at all appropriate for stem cell therapy. A 40-year-old who tears his meniscus and has surgery and is perhaps slow to recover, or someone with a first episode of a herniated disc in their back, that would be appropriate stem cell therapy, but not advanced degenerative or bone-on-bone arthritis. Stem cell therapy typically costs between $6,000 and $8,000. That's for appropriate stem cell therapy derived from your hip, or a little bit less if it's derived from your fat cells. I'm hearing patients paying this much money for the placenta or the amniotic sac stem cell. I will just give you a little bit of insight. I can order that for you. My cost is between $600 and $800 for the actual injection medication, and they're doing a 10-time markup, so they're charging about $5,000 or $6,000 for the procedure, which should be $400 or $600 plus the cost of the material. So please don't believe what you hear on the radio. It's very convincing, it's enticing, it's glamorous, it's new age, but it is absolutely the Wild West and it is unproven. The FDA has been caught unknowing and is scrambling to regulate this market, but right now it is basically regulation free, so these doctors or chiropractors are able to basically claim anything they want to because it's not regulated, at least not yet, by the FDA. So please don't spend the money. Please talk to your regular doctor or somebody who understands stem cell therapy before you go to the stem cell doctor, because that is what they're going to offer you for many, many thousands of dollars. Dr. Greg Costello, thank you.